Hey, good afternoon. Sorry about, we'll wait a few minutes as people come in from the waiting room. Sorry about getting started late. We were having some technical problems. We will be recording this webinar for people's interest, and we have time for questions too. All right, we may as well get started. Sorry so much for starting late. This is set up so that I believe that you can ask questions directly into the chat. And so I'll be keeping an eye on that for questions. I'm Joanne Spetz. I'm the director of the award network and also lead up our pilot award program. So I will quickly go through our presentation, but then I really anticipate that a lot of the value of doing this webinar will come from the questions. And please put in a note if you are having any difficulty seeing, let's see, oh, there's a Q&A. Yeah, please put a note in the Q&A if you're having any difficulty seeing the slides or any challenges with the presentation. So we are launching our second cycle of the award network. We are really excited to be doing this. We are planning in the future for future cycles to occur at this time of year. And that is in part because we wanted to make sure that people who might have applied for the National Dementia Workforce Studies Pilot Awards didn't have to do two pilot award proposals potentially at the same time, because we know there's a lot of overlapping interest between those groups. So what is the award network? Those of you who are here probably know who we are. We are a project funded by the National Institute on Aging to create a community of researchers engaged in research on the direct care workforce and the workforce in general, not just direct care, and the role of the workforce in the care of people living with dementia. The network is based at the UCSF Philip R. Lee Institute for Health Policy Studies, which is also home to the Health Workforce Research Center on Long-Term Care, supported by HRSA, and as part of the National Dementia Workforce Study. And the network is funded through May 2027. So our team is three of us here at UCSF. Myself, my background is in labor economics and public finance, and I've been doing health workforce research for many more years than I'm going to publicly acknowledge. Susan Chapman, who is a registered nurse and has a background in nursing and public health, and she has been studying the allied health workforce and long-term care for a long time. Laura Wagner, who's also has a nursing background and a doctorate in nursing, has a lot of expertise, particularly in nursing homes. Bianca Frogner, who is also a labor economist and is the director of the University of Washington's Health Workforce Research Centers on allied health and on health equity in the workforce. And Kezia Scales, who is the research director at PHI, which is the nation's leading organization that focuses on the direct care workforce. So we have a variety of activities, and many of you are probably familiar with them, including our annual meeting that we host in conjunction with other national conferences, monthly trainings, webinars, and workshops, summer training institutes. There will be 2 of them in total over our first 5-year period. We had one last summer, and the next one will be in the summer of 2026. Competitive research internships and pilot research, which are combined together now in the single call for proposals. And then we're developing resources and data to harmonize and accelerate your research. So the pilot awards are intended to support early stage research on the workforce that serves people living with dementia. That research could be qualitative, quantitative, or use mixed methods. It can be national, regional, or local. And it can focus on any topic related to the workforce and care for people with Alzheimer's disease and related dementias. And your proposal can include preliminary data, but that's not required. We have 2 types of awards that we're offering this cycle. What we're calling full awards are up to $25,000, and these are really intended to lay the foundation for a future large grant. And then we have what we're calling mini awards. Last year, these were called research fellowships. And we decided to rethink what those were aiming to achieve based on the proposals that we received, to really think rather than the idea of applicants wanting to go and spend time with a mentor in person. We wrote that as an idea before the pandemic happened. And now, with such a well-connected world virtually and in a hybrid standpoint, what we found is the needs of the award network members was much more around small support to help with things like purchasing a data set or providing gift cards for interview subjects or other aspects of research that are often not funded or maybe a little beyond what was funded in a project, or for a doctoral student might not be easily funded through other funds at their university. We have a total of 50,000 budgeted in this cycle. So while we really would love to fund multiple of all of these awards, we're going to have to see what awards come in and what their budgets are. If it's possible for you to propose a smaller budget and get your work done within a smaller budget, that is great because it enables us to spread our limited funding to more people. So our priorities are projects that focus on the direct care workforce, but that research can include a focus on other professionals. But we will prioritize direct care workers because there is much less research on the direct care workforce than on other professionals in the dementia care sphere. We also are interested and will prioritize projects designed to help the applicant collect the data and research skills that they need to support a strong NIHK award or R award application, like an RO3 or a KO1 or a K99 ROO. And we also will prioritize supporting early stage scholars, but really applicants can be of any rank from any organization that's qualified to apply for NIH grants. So for full award projects, some examples of what that might look like are doing a small interview study with home care aides that might produce preliminary data for a larger proposal, perhaps writing a new paper from old data that might have new co-authors to establish the relationships and the co-authorship that lays the groundwork for future proposals. Maybe you want to do preliminary analysis of one of the NDWS families of surveys and prepare for a larger proposal using those data or some other data sets like the American Community Survey or PBJ or some other data source. Conducting a series of focus groups with community-based organizations to develop ideas for a new study on community dementia care services and workforce challenges would clearly be within the scope of what we're interested in. So it's a pretty broad set of activities you could do for these full awards. For the mini awards, these could be adding a second site to an interview study, and you might have some travel costs or gift cards for subjects that you need to budget for to do that. You might have data access fees that you would need to cover for accessing data in one of the federal statistical research data centers, or to purchase a data set. Maybe you want a transcription service for a focus group study. So these types of things would all be well within the scope of a mini award. So eligibility is to be an award network member, and it's very easy to become a member, so that should not be a barrier to anybody. To be holding or pursuing a doctorate, and if it's a clinical or practice doctorate, to have had some training in research. So if you are, if you're a physician, please be sure that you provide some information about the research training that you've received. Similarly, if you're a DNP, what is your research training? Because the clinical doctorates don't always provide it, but you may have obtained it through a number of other mechanisms. You need to have a faculty, research scientist, postdoc, doctoral candidate, or equivalent type of position. You do not need to have U.S. citizenship or permanent residence, as long as you would be qualified to potentially apply for NIH grants and being an organization that is considered by NIH's terms fiscally responsible and meets the requirements of NIH. We do encourage applications from populations underrepresented in the U.S. biomedical, clinical, behavioral, and social sciences research enterprise. But I should note that we will be following all current federal guidance and requirements around those applications, which I think specifically now require that we not prioritize or indicate discrimination in any way on that basis. But we do really encourage everybody to apply. We will have a full peer review process and want to have a range of applications that represent a variety of different research areas to have as strong a pool of strong applicants as possible. So the deadline for applications this year is going to be the end of February. Please note that that's 11:59 p.m. Pacific time. So if you're on the East Coast, you can send that thing in at 2:59 a.m. on March 1st, but please don't stay up that late. I hope you don't. You can submit the application as a single PDF via email. The information is in the website and in the RFA document. The components include a cover page, a proposal body, a budget and budget justification that would use NIH forms, a bibliography, and NIH-style biosketches. So for the full award, the proposal body should describe your study aims, the importance of the research, the approach that you will take, your future aims. As I said, this is research intended to set the groundwork for future studies. So what do you plan to do next? Do you imagine that this is going to lay the groundwork for a K award, an R01, for it's part of, kind of what is this part of? How is this going to build into the future? And then who is on your research team? And here you could mention your mentors, but you may have mentors that are going to support you in the research, but that you don't have included in the budget. So this is a great place to mention who your mentors might be. For the mini award proposals, those are only 2 pages maximum, single spaced. Purpose of the request, why the research is important, your qualifications, and your future aims. And so these, of course, are much shorter. There is much less money that you are asking for. You're probably asking for a fairly limited purpose, and can probably bang out those applications fairly quickly, honestly. For budget specifications, the maximum for the full awards is $25,000 in total costs. You can use that for pretty much anything that NIH would allow you to put into a budget. But please note that your indirect or F&A costs are at a rate that your institution proposes. It can't be higher than what their federally negotiated indirect cost rate is. If your institution would allow you to use a lower rate, please do. We found on the last cycle that most institutions wanted the full federal F&A rate. So start researching that now, because it will really affect your direct cost budget. So this is a total cost budget that we have here. For the mini awards, these are $5,000 total cost, because we actually issue these as a single or in 2 installment of payments, as essentially a kind of billed for services. So because it is not a subaward, the F&A costs are not something that go into our budget, but your institution may have overhead costs that they want to build into your invoicing. So be sure you research that with your organization so that you are not surprised later. For selection criteria for the full awards, we're following the NIH guidelines on how proposals are reviewed. So the 2 scoring categories are the importance of the research question and the rigor and feasibility of the project. Unscored but items for consideration include the expertise of the investigator relative to their career stage and the adequacy of the institutional resources available to support the research. So those items are not scored, but there is a need to assess whether is this researcher actually qualified to do this, and is their institution appropriately resourced to do this. And it's really just around kind of the feasibility of whether you're prepared to do what you believe you want to do. But that is not a scored merit-oriented criteria. It's just a minimum qualification. And then the likelihood that the project will lead to a larger proposal won't be scored, but it'll be part of the discussion for funding at the end. And alignment with the priorities and funding opportunities at NIA. Ideally, if you can identify one of the NIA AD/RD research implementation milestones, that's fantastic. So putting that together is great for your proposal. For the, whoops, I accidentally went backwards. For the mini awards, it's very similar. The relevance of your research interest to the workforce that cares for people living with dementia, the relevance of the proposed use of funding to advancing your research, your expertise relative to career stage. So if you're a doctoral student, that's a different career stage than if you're an associate professor, and the alignment with the priorities and funding opportunities at NIA, thinking about the long-term trajectory of your work. Our selection committee is various members of the award network from different career stages, including the 3 awardees from the first round of pilot awards. So Emerald Jenkins, who we are thrilled to say just completed her doctorate and is now a program officer at PCORI. And then Kate Miller and Karen Shen from Johns Hopkins were awardees on the last round. And then we also have Walt Dawson, who's at Oregon Health Sciences University, Kate Miller, or I already said Kate's name, Rachel Przinski from University of Washington, Zara Rahemi at Clemson University, and Hari Sharma at University of Iowa. And in the review process, any reviewers who might be conflicted will not review your proposal and will be asked to be quiet when proposals are discussed. For the final selection process, we'll bring the top scoring proposals to our advisory board for guidance. And then we will do our additional consideration and prioritization in that conversation with them about early stage investigators. Actually, the second bullet point may not be permitted in terms of underrepresented minoritized groups. So if we are not allowed to do that, given new federal guidelines, we will not be doing that. And then also consideration and prioritization for alignment with the interests and the purposes and goals of the award network. So we're now at the question part of the webinar. So I'm going to stop sharing and keeping an eye on the question and answer box so that I can answer any questions that you all might have. There is none. No questions, folks? And if you want to ask a question anonymously, I think it's possible to do so and hide your name. I'm going to wait a few moments and see if any questions come in. And if none come in, you all, of course, can leave whenever you want. We will be recording the full time until there are no more attendees. And then we'll be posting this on the website early next week. I do know we did get a question, I think by email, that I can respond to now from somebody who I believe had probably applied to the NDWS Pilot Awards and was, I think, waiting to hear about that so they knew whether they should be thinking about applying to this. And it's my understanding that those, they I believe said that they would be making or notifying people no later than the end of this month. And it's my understanding they are on track to do so. So there you go. Of course, those were much larger pilot awards than what these are. So you may need, if you decide you're going to bring your application into this, you may need to think about how to rescale your aims or whether you have alternative or matching funds that could fill the differential. Because of course, these are much smaller than the award network pilot awards. or the NDWS Pilot Awards. The NDWS Pilot Awards will have a new mechanism, or they're going to have a new announcement coming relatively soon as well. All right, we have a question about if you are a postdoc and your role changes and you're awarded funding, does this change your study time frame? Oh boy, well, if a postdoc or a doctoral student completes their work and moves on to a new position, first, we would certainly collaborate to make sure that the subaward, if it's a full award, gets moved to the new institution. And if it's a mini award, it's actually much easier. And so we also can look into extending the timeline. Having a no cost extension should be quite feasible. The initial pilot awardees did end up with a somewhat extended timeline because of the timing of the proposals relative to our funding year created some delays in getting things awarded, which was another reason that we moved this into the early part of this year, because it will better align with our annual kind of when we get renewed for our network as a whole. So the timing should hopefully go more smoothly. But yes, no cost extensions are possible. We can totally make that happen. And we would, of course, congratulate anybody immensely for completing a dissertation or a postdoc or finding a new position that they're excited about. So any other questions? Let's see, the awards are generally intended to be only 1 year. So please think about scoping a project and writing a budget and such for 1 year. But as I said, if you ended up moving and needing an extra 3 months, because I know moving can be very disruptive and take a lot of time, then as I said, we can always arrange a budget justification or arrange a no cost extension. But we would be very unlikely to be able to add to the budget with a change like that. I wish we had funding for multi-year pilot awards. For the expectation for the products, for the completion of the full award, in general, we anticipate that most people will try to be getting a journal article out of their full award project. And that's, I would say, on average, what most people have proposed. We also will ask that you present your work either at one of our annual conferences or in a webinar. And that can be, towards the end of the project or during the Academy Health Award Network meeting. Emerald and like basically all the awardees talked about their projects. They were in early stages of doing the work, but it was really fun, I think, for everybody to hear about those projects in more detail and just the enthusiasm for the work that they're launching. So as those projects are completed, we'll be asking those folks if they're available to do a webinar or present their final results for us. And also lessons learned. I think in any research project, we all learn something where a data set's harder to get than we expected, or the people that we interviewed said things we didn't expect. And so our interviews turned down a different pathway. And so there's opportunities also for us to all learn from each other about conducting research and the process. So there would be, I think, an expectation of some kind of presentation along with what would likely be a publication. If you want to propose multiple publications, that's great. Or if you think that your main product at the end of the project would be a grant proposal, I mean, that's a pretty big product. So that is, we're certainly welcome to that being proposed as a product. Let's see, when decisions will be made. Oh, and the IRB approval timeline. Of course, so most of these projects are some of them are exempt and some of them do require IRB approval. Let's see, I'm totally blanking on what our announcement timeline is, but I am pretty sure that we have that on the website. Or at least I thought we put it on the website. So we are, let's see, there's the full request for applications. So, which I should have had open already. So let's see, we're planning to make award announcements by mid-April. We already have the review committee convened and or have a meeting on the books for the review committee. And with the deadline timeline, we're going to give them a good amount of time to review the proposals. And that will give us enough time to then compile their reviews and have a meeting. And so no later than the middle of April would be when you would hear. And that then should give some, time for the subaward setup process and so on. And our team at UCSF would, work with you. Basically, the proposal you submit becomes the subaward proposal. And then our team would work with your grants office to put a subaward into place for your institution. And if you are doing secondary research, that's fine, can be exempt. And if you're doing primary data collection, then you probably will need to think about what your IRB timeline is going to be. And sometimes we can issue a subaward if there's a promise that you won't touch any human subjects until the IRB is in place. So if you have preliminary work that you need to do before you interview subjects, and that's part of your timeline and your proposal, we can work with our grants office to basically kind of add to the subaward a condition that you cannot do any of the human subjects work until the IRB is in place and documented and shared with us, but that you can, do whatever preliminary work is necessary before you begin your human subjects work. Like, if you're developing an interview guide and that's going to be based on finishing a literature review that's underway, then it may make sense to have your first 3 months being developing your interview guide. That would be, and then, it's hard to submit your interview guide as part of your IRB package if it's not created yet. So that kind of timeline, we have workarounds for that. I hope that's helpful and answered your question. Any other questions? Let's see. All right. I'm not seeing any new questions coming in. I am seeing, hopefully my cat's tail is not ghosting too much in front of the webinar. So any other questions kind of going once? And of course, you can always email as well to the Award Network email address, and we're keeping an eye on that and answering questions as they come in. We haven't had enough questions yet to really warrant having a frequently asked questions document. We did try to incorporate questions that were asked last time into the revision of the RFP. But if we do get questions that are kind of generalizable and that might be of interest to multiple people, or we think multiple people have similar questions, then we certainly will, create a frequently asked questions document. So, glad this was helpful, Maria. Glad to see your name out there. So no other questions. That's kind of all the information for this year. Feel free to email additional questions to the Award Network. We'll be sharing this on the website. I hope you all have a good weekend ahead. And I'm looking forward to seeing your research ideas for mini awards or for full proposals. And is it next? It's coming soon it's in about 2 weeks or a week and a half. We have a great webinar coming up. So we're looking forward to that as well. So thank you, everybody. That seems like we might be done for the day. Have a good weekend.